Good morning. I would like to ask your permission for Dr. Abbasi to use this for educational purposes in print as well as on the YouTube.
Yes.
Okay, and do we have your permission?
Yes, you do.
Perfect. Okay, I'll start with you first. When did you first visit with Dr. Abbasi, and what was that in regards to?
The first time I saw him was probably in April of 16, and because my left leg was going where I didn't have any feeling in it whatsoever, and I would fall over. And it got to the point where the pain was so bad I just couldn't do it. I just couldn't stand it anymore.
Okay.
So I was sent here by the VA department because they don't have a surgeon.
Oh, okay.
So they sent me here, and I'm sure glad he did.
Oh.
This guy, this man is fabulous. I had the surgery in November of that year, and when I woke up from the surgery, I swear I could have walked all the way home.
Wow.
It was no pain whatsoever, and I felt just great.
Wonderful.
I've never felt that good for such a long time that it was unbelievable. I mean, it was just fabulous.
Fantastic.
Yeah.
Did you stay overnight in the hospital?
No, it was 30 minutes. He did surgery for 30 minutes, and I sat in or laid in the recovery room for 30 minutes, and then went home.
Fantastic.
Oh yes, yeah.
And how has your recovery been since the surgery?
I've had no problems with my back whatsoever. I don't do as much as I used to do, but now I know when to quit when my back starts bothering me a little bit, and just quit, go sit down, or quit for the day, or
Sure.
yeah.
Wonderful. Well, that's fantastic news to hear that you're not only did you have the OLLIF procedure done that day, but
Correct.
you also were able to go home that day as well.
Yes.
And we're 2 hours away. So it was a long ride, and he did fine on the ride home, and has been doing fine ever since. So
that is fantastic. That is wonderful to hear. Now, I also noticed that you have come in for a cervical
Problem in my neck where I have growth in my neck and calcium deposits and arthritis in there.
Sure.
And I was getting to the point with that where the pain was so bad I couldn't stand it.
Sure.
Well, I found out that one of the reasons why was because my muscles were so tight that it was pulling on it.
Oh, okay.
So I did therapy, and after therapy I was good again. And to this day, I'm still good, but I'm going to come back in 6 months, and he's going to look at me again, and he said that it's going to have to be fixed. So,
Sure.
So for now, it's fine. Well,
wonderful.
yes.
and he
Good. That's fabulous. That's great to hear. It's nice to hear that you're able to use the conservative therapy and kind of stabilizing everything for the moment.
Yeah.
So fantastic. That's great to hear. And I also understand that you are being seen today for back surgery as well.
yes, I am.
And can you give us a little bit of a
He
background?
did so well on my husband. I thought, well, as long as mine is as bad as it is, I'm going to have him look at me. And I have spinal stenosis, and he's going to. And I just can't handle the pain anymore. And I had been going to chiropractors, and they couldn't fix me. And so here I am. And I love coming to him because he, as with Ron, he explains, he shows you all the pictures, and he explains why it's doing this. And he explains what he thinks he can do. And he tells you, okay, I'm going to fix this part, and then we'll wait and see. Because he doesn't like to be real aggressive with it. And if he fixes just this much and it's perfect, wonderful. Because then I don't have to do the whole big surgery and turn out wonderful maybe in the end of that. But I like doing it in the
kind of in stages.
Yeah, why do so much? We'll do this and see how you come out. And I love that. And he explains it in my language, so I understand what he's doing.
Have a wonderful day.
Thank you.
Thank you.